Jakub Tolar. I have a large stem cell lab. I'm a bone marrow transplant physician, and I treat children and adults with leukemia, with genetic diseases, and I design ways of making gene therapy safer.
What sort of diseases do you treat using gene therapy?
I treat monogenic disorders. That means that the faulty gene is a single one in the whole genome. A good example of that is enzymopathy, or a deficiency of an enzyme. In that category, the most classic one is mucopolysaccharidosis type 1, called Hurl's syndrome, which leads to a accumulation of complex sugars called glycosaminoglycans in all cells of the body. And unless the children are transplanted early in life, they die of that disease. Another group of diseases that I treat are bone marrow failure syndromes, such as DNA repair problems. The most usual example of that is Fanconi anemia. They cannot repair their DNA, or dyskeratosis congenita, where they don't have a mechanism whereby they repair the ends of the chromosomes.
What is your opinion on the usefulness of gene therapy in medicine?
This is the next thing. This is the next big thing. If you can do it safely, this will change the field of medicine entirely.
How do you feel about risks associated with using viruses such as lentivirus and retrovirus vectors?
There are grave risks that are involved in any therapy in medicine. There's nothing in medicine that I know that has no risks, and gene therapy is no different. The viruses are used because they are the only means we have to introduce the genes into the genome. We are not smart enough yet to do it better. So that's why we use the viruses, and that's why we have to accept that they have side effects. So out of the about 75 people who were treated with gene therapy, about 15 of them got leukemia or lymphoma, cancer of their blood system that is directly related to the therapy that they received. And we have learned from this. There was no other way of learning this but using the gene therapy in the gene therapy trials. And based on that knowledge, we designed better vectors that are much safer.
What example? Can you give an example of such a vector?
One of them is called self-inactivating lentivirus, which means that we have taken away the means of the virus to replicate. It cannot make more copies of itself, and it also cannot activate genes that are in the neighborhood where it inserts itself.
I have some questions from a class survey that we did, which I would like to ask you on behalf of my colleagues, classmates. Are we at a point where gene therapy is actually a standard treatment for any certain genetic disease?
Yes.
What disease?
Severe combined immunodeficiency is much better treated by gene therapy than bone marrow transplantation. It's a lethal disease unless you treat it. Adenosine deaminase deficiency is much better treated by gene therapy than bone marrow transplant. And that's probably the two best examples.
In the future, what do you think can be accomplished with gene therapy, and what is possible with the publication of usage of gene therapy?
So in future, what's going to happen is that we will not use viruses. What's going to happen is that we will be able to do a genomic surgery directly on the mutated nucleotide and nucleated base. And we will go directly to the site of faulty gene. We'll take the single molecule out that makes the gene inactive and disturb nothing else. And the process whereby this can be done is called gene editing, and it's already in preclinical phase of testing.
And finally, what is your opinion on the patenting of genes?
the genes themselves cannot be patented because there are no intellectual property in them. They have been a part of evolution, and we share them with anything from plantaria worms and Drosophila flies. They are identical genes to what we have. The ways of using the gene therapy methodology, that should be patented, that should be open to private enterprise, because in the history of medical design and medical development, the private sector has been much more successful than I think in academia to get it to the patients themselves.
All right, well, thank you very much for your time.
You're welcome.